Okay. All right. So, yeah, this is the third time
Sure.
that I've had they've tried to put me with a certain vendor.
She needs to talk to her because she's already got the case active on her.
Oh.
She can tell her what's going on.
Okay. Nikki wants to meet with you.
Well, Nikki didn't help me before. I'd rather not meet with her.
Well, you'd have to start completely fresh then because he doesn't know anything that's going on.
Well, Nikki hasn't done her job at all. Is she like?
She has done her job.
No, she didn't.
You
She's
have
the
not-
one who
you-
didn't do
It has
her
not been
job.
resolved to your dissatisfaction yet, but she's been doing her job.
No, she hasn't.
She
She
still has
hasn't.
talked to you about it.
I mean, this is like
Well-
this has gone on. You call this doing somebody's job? This has
So,
gone on weeks.
Let's do this.
No, I don't want to talk to Nikki. Tell her. Forget it.
Well,
Forget it. Let's just start over.
No. Hang
Jonathan's
on.
been better.
No, we have to.
Hi, Debbie.
You didn't do your job.
I'll tell you how I did, okay? So
I would like to know.
Yeah, so I sent a message
Yeah, I'm
to
talking to
your
Nikki here.
primary care provider back the first time that we spoke.
Okay.
She finally got the consult placed on,
You
what
got
day
it
is
on.
it, May 2nd?
Where are we looking?
Oh, sorry, April 30th.
Okay.
She finally got it put in.
Mm-hmm.
And we had spoke, I think, on like the 21st or something.
Mm-hmm.
So she got it put in on the 30th.
Mm-hmm.
But then community care got it, and it was prior to the date of your current consult that you have right now doesn't expire until a certain date, and they can't do a new consult until 30 days right before that date. So they canceled it. So then I had to go back to your primary care provider, have her resubmit
Who is my
it.
primary care provider? Because she was
Elena
transferred.
Pon.
I've never even met
P-O-H-N.
her.
Well,
Yeah.
that's who you're assigned
Is it
to right now.
Ramsey?
No.
Yeah, I
yes.
think so. Yeah.
Yep.
Okay, because the one doctor that I liked was transferred to a different clinic, and I haven't been able to even see my new provider. So
Okay, yeah. But if that's who
you've
you're
talked to her
assigned to.
before I have.
Want me
Okay.
to write that
That's,
down?
yeah,
Yeah.
So you have it?
that's really
Yeah.
interesting because in case I have a primary, I would like to know who my primary is.
Sure,
Because
of course.
when I go to the ER, I can't get help.
Oh, why?
It's really quite unprofessional. That's
Why
why
not?
I don't play any games here anymore.
That's your.
Well, I had
Primary.
food poisoning last week, and they just denied me care. Do you think that's professional?
No.
No. Plus, they followed me out of the ER
Well, what
with
happened?
the security. I have
Did
no
they-
idea what they were doing. Nobody does.
Did they provide you?
It's scary coming
anything?
here. It's scary for me coming here.
Oh, okay. Well, I mean, you can also go to if you have an emergency.
I don't know what is going on. And this Optum.
Do you want me to answer your question though?
Well, Optum keeps.
I was gonna
keeps
tell you that
canceling
if you-
every contract,
No.
every vendor that. Well, why do I keep getting these phone calls from these? Why did I just get a phone call from a nurse today?
So she was trying to get your consult because I got it reinstated by your primary care provider. So she was calling to make sure that you knew where you wanted to go. So she was gonna
We've
move
already
community.
discussed.
Let me
this.
finish, please.
Like I said,
She
I
let
said
me-
the closest one. I said the closest one.
You have to decide where you want to go, though. You have to tell them,
I've
yes,
already
I
talked
want to
to
go to
community care.
X.
I've already talked to them yesterday.
It's a
and
new
I said
consult.
Emily,
It's a new
and she
consult.
said to community care, and they said they have it. The only one, all the other ones were shaded out, and the only one that I could have gone to was Emily.
Yeah. There's a lot of.
Then she called. Then they told me today. They said, "Oh, the only one. Why did I go to Brian again?" And I said, "Well,
Who's Brian? I'm
Brian
sorry.
Calderon.
Who's that?
He's one of the therapists that I already
At
saw.
Return to Play or
No.
somewhere else?
No, but I'm just getting nothing
Where's
but the
he at?
runaround. He's in Minneapolis. I already went to him, but him and I had a falling out. So then
Oh, gotcha.
then
So
we
you
were-
don't want to go there again.
well, we had a kind of a falling out because he was forcing me to go to the St. Paul location, and I said, well, I'd rather not drive that far. That's
Sure.
it. That's it. It wasn't anything more than that.
Okay.
And then they were gonna put in for a closer location.
Mm-hmm.
Okay.
Yeah.
And then this has gone on months now, and you guys just
No,
can't
it
seem
hasn't
to
been
get
months. It's been
anything
a couple
to.
of weeks.
No, it's gone on for me since February.
Okay. Well, we didn't get involved until April.
I didn't. Well, why didn't you? Why isn't
You didn't
this
call
been
us
handled?
till April,
No, I have been trying to get community care on the phone and
but not us.
the patient advocate.
Yep. So we talked in April, and I've worked on this ever since. So the reason they called you today is because I got the consult reinstated. She needed to confirm who you were so that she could determine where you wanted to go, and you refused to give her that information. So she was unable to provide you she was unable to move
Why
the
is a
referral
nurse
forward.
involved in patient advocacy?
She's
Yes,
not.
she's
She's
with
on community care.
So we don't run community care in this office.
I'm getting so many phone calls
Yep.
and
get you
nobody
scheduled for the
is
massage.
doing their job.
So just
So I just keep getting all these phone
Sure.
calls,
Yep.
and
She
then,
was calling
and then
to get you
it's a run
scheduled for
around
your
here,
appointment.
and then they give it to this
So-
person, and then you give it to this person, and it's called
Just
the
hang on,
runaround.
but to
We're
give you
getting the runaround.
Yep, just an idea.
Oh, no.
Stop
One
talking
sec,
for a minute
Debbie.
so he can he
One
can
sec.
answer you.
So
Is this going to
Stop
be
for a
scheduled?
moment so he can answer
I
you.
need to talk.
Okay.
But we're not going to get anything done here today.
Okay, yeah, because we're not going to stop until we do.
Yeah, so community care, we have nothing to do with the vendors or anything like that. The role of this office is to work as a liaison between you and them.
Okay.
That's what we do. We don't
Okay.
control anything that's in their network. We don't control any of the vendors. We don't control any of the
I
appointments.
understand that, and
So-
you've been pretty good in the past.
Yeah.
I had no problem with you,
But community
but
care.
then what's been happening to me recently, just so you
Yes.
know, is that I'll have something scheduled, like I had something scheduled with Northwestern.
Yeah.
Then all of a sudden, Optum will come in and they'll say, "Oh no, we can't work with them anymore." They
Yeah.
keep
So-
canceling the vendors.
Yes.
And
So-
we're wondering, and they canceled, and the same thing happened with Return to Play.
Yeah.
They said they were contacted by Optum.
Yes.
And they said, well, we can't work with them. They can't be vendors anymore because they're not licensed.
So-
and then we looked up the law, and it's really interesting because you don't have to be licensed
So what happens
in the state of
Correct.
Minnesota.
So what happens?
You just have to be certified.
Yep.
Yep.
So what,
Okay, so why does Optum not know their job?
So,
and Optum
hang
keeps
on.
Can
canceling
he
our
answer
vendors.
your questions?
So
We don't like this Optum
Can he
company.
answer your
Debbie,
questions?
At all.
Debbie,
hang on.
stop.
I need to talk.
Okay.
Otherwise, we're not this. I'm going to call and make an appointment because we're going to get nothing done
No,
here.
no, go
and
ahead.
it's Friday, and I'm not going to scream at a patient.
I know. It's Friday.
So, community care is all under the Optum umbrella. That is through Congress. That's through the White House. We have to use Optum. Now, here's the thing.
How is this a third party company involved
That's
at
what we
all?
use.
That's what
in
community-
VA
That's what
care?
we use.
That's what.
But
community-
why?
Because
Okay.
you're choosing community care.
So, okay. For
Oh, be care in the community.
is
And so
Optum
it has to be
Control it.
separate insured.
correct?
Okay.
So that's the carrier.
But this Optum company is not
But hang
taking
on.
care of veterans.
Hang on.
I went for a VA rating
Yeah.
with Optum,
Sure.
and they tried to get me arrested.
So here's the thing.
Okay,
with
I could not believe how. And then,
So-
let's see, I found about 300 other complaints online from other veterans
Yeah. So-
by Optum.
Okay,
You
hang
think
on.
this is just me?
Nope, it's not.
It is not just
But,
me.
okay,
They
you-
are not, and they keep canceling all the vendors.
Okay, Debbie, I need you to listen to me just
Okay.
for a moment.
Yes, we
so
will.
this
Discuss
is
this.
national. This is not a local thing. We are talking White House level.
Oh, that's fine.
That
That's why I'm
mean-
recording it, so we
that's
can
fine.
discuss it all the
But
way up.
I'm not done.
I'm not done either.
So
Let him
we
finish.
have to use the VA only pays Medicare rates, which
Mm-hmm.
means the outside world chooses to terminate contracts with Optum. That is why it is a money thing. Healthcare, that's the
Mm-hmm.
bad side of healthcare. It's all about money. And
Okay.
if they're not making money, and if those providers aren't getting it,
Yeah.
because we're only paying what? Your appointment, they're making probably $20
Yeah.
to $30.
Nothing.
If they're billing regular insurance, they're getting $300 to $600 for that appointment. Why would you be in the Optum billing network? Why would you? You
So
wouldn't.
these are their choices.
And this is congressional. This
Okay,
is a
so-
congressional law.
Okay, so say that again, Jonathan.
Let me
So-
finish.
so-
Can I finish
Yes.
my part real
No,
quick and
no,
then
go
I'll
ahead.
step
No,
out?
no,
No,
you're
that's
good.
okay. That's
No.
okay. I'm trying to understand,
today I-
and
yep.
I'm just trying to understand because I'm just getting the runaround.
You are,
and
yep.
and
let me just tell
and
you
this
where
is
we're
not the
at.
first time I've had an issue with Optum.
Sure.
I got sent
Can I
for
tell you
a
where we're at
VA
for
rating
massage
at
really
the one
quick?
in Egan.
Yeah.
And they said they couldn't see me because I didn't have my ID with me. And I
Okay.
was like, why do I have to show my ID to begin with? It was scheduled by the federal building.
Yeah.
And then they wouldn't see me. And then I'm on the phone in the waiting room with Optum in Egan, and they said, you're making a scene out here. And they called the police on me.
Yeah, the outside
Okay, do you
world-
call that a professional company?
No,
If
that's-
you're
working with
causing a
veterans?
scene,
I
they
was
are gonna
not
do
causing
that.
a
But
scene
the outside
at all.
But the
I was
thing-
calling my
okay,
federal.
But here's
If
the
you're doing
the
this
person
and
at
you're
the
talking over
VA.
people
Yes.
like this, it is
This
disruptive.
so here's the thing.
I'm trying to discuss
Yep.
this matter.
Yep.
So let me
In a
finish my
polite
part
way.
real quick.
Sure.
So your massage therapy consult, I talked to them today. They reached out to me because I was the one who's been working on this.
Yes.
They
And
said
she's
they
being
attempted
accurate.
to contact you. You were unwilling to verify your information, so they were unable.
I told her
Let
my
me
name
finish,
and
please,
Social
Debbie.
Security.
Let me finish.
I wasn't unwilling to do anything. Who is this
You're
woman
very
calling
frustrating.
me? Okay. I
Debbie?
gave her my name and social security number, and then she asked for my address.
She
and I
has
was
to
like,
verify
what?
your address
Who
because
is this?
She has to verify your address because she needs your residential address to find the place that's closest to you. That's
That's
part
how
of
they
their
look up
policy.
information.
So without you being able to do that, they were unable to move your massage consult forward.
They have the
And
correct
therefore,
address in the
let
system.
me finish, Debbie. And therefore, if you don't work with them by Monday, they're going to cancel it again.
I already
I just
gave
want you
her
to
my
know
name
that.
and social, and I said, you have all the correct information
So I
in the
want-
system.
So I want you to know.
That's it. What else did she need to know? I don't know this woman.
So I'm not going to sit here and have you yell at me.
I don't know
so
this
I just want you
woman.
to understand that
and
she's
I was
from
almost, and
community
then
care.
I had a bad experience at the
All right.
ER
I'm
with
good.
a
I
nurse.
just want to let you know that on Monday
Already.
it will be canceled again if you're unwilling to provide them that information.
I
okay?
did provide the med information to the nurse
Your
who called me
address.
this morning. Okay, well, they have the address on file.
You just need to confirm the address and
Fine.
they'll be willing to get that scheduled for you.
Fine.
Okay.
Okay.
All right.
Are we
So
done
we're
here?
all done with the
I think
Okay.
massage.
Oh,
Okay.
because
Thank you.
I
Are
don't
you
know how
done
to.
here,
Apparently, I don't know how to communicate with nurses. Is
Or
that it?
anyone.
Do
What
I
it
need a
sounds like.
PhD to communicate
Well,
with nurses?
Debbie, we're
Are
not
you done
communicating
here?
very well right
speak,
now.
I spoke to her this
But-
morning.
but
I gave her the
this is not
information.
communicating.
But now
Except
you're
for
saying.
your address.
Oh, I did give her my address. I said you have the
False.
correct information on file.
She just wanted you to verify it, and you
Okay.
were unwilling.
Okay. Why does that matter for community care?
She needs to know where to send the consult and tell them your address. She needs to confirm you're the right person.
Okay, because you want.
If
because
you don't want to do that,
why would
then
that?
they're going to cancel it.
I've
You're
been a
welcome to leave now,
veteran
Debbie.
for 13
Debbie,
years.
I think it's time for you to go.
I've been a veteran
Do you
for
have any
20
other
for,
questions
for
for us?
13 years for 20 years.
Do you have
And this
any
is how I'm
other
treated.
questions for us today?
I would like to know more about Optum. Why is Optum even involved?
Because they were the ones that bid on the community care contract.
Is
They're
there
the
the
ones
answer.
they're the ones that were awarded the contract.
well, we need to unaward them the
That's not
contract.
happening
You go
on
work
this
with
level.
National
You
about
have
it.
to go to
I want to speak
congressional.
to whoever else I need to speak to about
It won't
Optum.
be
It's
in
not
here.
local.
It won't
Okay,
be
then
here.
who else in the
National.
VA
You gotta go to
facility?
the White House.
Who else in the VA facility can I speak to
There's
about complaining about Optum?
There's nobody else here.
Well, who is in the corporate area of the VA about Optum?
They have nothing else to do with it. It is national. We don't have a choice. We are forced to use the Optum billing.
Well, they suck.
That's you can say that absolutely.
Absolutely, they suck, and we don't trust them.
Yep.
They are abusing veterans.
Okay.
Is that clear?
I-
That's the whole point I'm
that's-
recording this for.
Sure,
The
that's your
Optum is
opinion.
abusing veterans.
Sure.
We can't get anything done in community.
Yeah.
Nothing.
Yeah.
Okay.
But so
All right.
but
Here's the National VA hotline for you to call, okay?
Okay. I got the
Alright.
National VA hotline. Okay, veterans, we need to call the National VA hotline and complain about Optum.
Okay.
I only got about 9,000 people watching my channel
Sure.
weekly. Are we clear?
Great.
yeah.
I'm not playing any games with this dumb
If you're
company.
not playing games,
I think
we're
it's time for you to